Homelessness is a problem which affects almost every community in Great Britain. Wolverhampton has always had a relatively small number of homeless people, but over the last few years those numbers have unfortunately gone up. So 2 years ago I asked the council to work together with our partners and bring together a task group which could look at tackling the problems of homelessness in our city more effectively. I'm pleased to report that we've had some quite good success in reducing numbers and also ensuring that people have accommodation when there are cold snaps and indeed when there are other problems that arise. The challenge for us has always been to try and intervene early with people who become homeless and indeed to do some more work around prevention of homelessness. It's also been crucial for us to try and bring together the many voluntary and community groups who are working very closely with people who are homeless. This is an incredibly generous city. People do give a lot of money to people who are in need. Unfortunately, there are times when those people are vulnerable and are exploited by others. The task group has shown us that there are things that we can do to help people in those sorts of circumstances and indeed to bring down the overall numbers of people facing homelessness. I'm very pleased that this work has been undertaken and I look forward to watching the impact of the many voluntary community groups, our public sector partners, the council itself, in trying to tackle this really serious problem in the future.
I'm Tanya Johnson. I'm the Rough Sleeper Coordinator of Wolverhampton and the Navigation Manager for P3. The task force, it's been an honour to be a part of and it's been something that I think has just drove Wolverhampton for working in partnership together so well and so strong. It's an amazing task force to be a part of. The results that we're having, the impact on the city, the impact on the rough sleepers, that's all positive. It's just amazing. Our neighbour cities, their rough sleepers are increasing, their numbers are increasing, and Wolverhampton's are decreasing. So we're at the minute the lead for other cities, and we are sharing what we do, because if we can tackle rough sleeping with ourselves, our neighbours, that's what it's about, isn't it? It's about tackling rough sleeping. So yeah, we are one of the most proactive.
The task force is a public health-led project that looks at combining a number of organisations together to address issues around rough sleeping and street homelessness. So we have organisations ranging from the police, antisocial behaviour, city council, health, voluntary sector organisations, faith groups, and also a number of interest groups across the city. So it's a citywide approach to how we address issues related to rough sleeping. In Wolverhampton, we're starting to see a slight decrease in the numbers of people rough sleeping, which is bucking the trend nationally. However, there's a lot of work that needs to be undertaken. For us, this isn't something that we'll just do and then forget about 6 months down the line. It's making it part of business as usual. So it's the organisations that work out there, it's making sure that what they do as part of their core business is addressing the issues of rough sleeping. But also it's how we prevent people from rough sleeping as well. It's not as simple as just those people that are out on the streets, it's the one that are potentially at risk of rough sleeping. So we need to address it as a whole.
That's why we're delighted to have received funding for the Housing First initiative, which will enable us not just to provide accommodation to people who are homeless, but also to ensure that they get the support through outreach workers that is absolutely crucial to helping them tackle the many, many problems that they face.
My name's John Denley. I'm the Director of Public Health here at the City of Wolverhampton Council. I think when we consider rough sleeping, there's never one single answer or solution to enable people to be stable within their own homes, within their own communities. There's all sorts of issues relating to why a person was in that circumstance where they are rough sleeping. So through the impetus that the Leaders Task Force have put into rough sleeping, we managed to be able to create the momentum of getting a group together. And that group had all the agencies around the table. We worked through sharing data and using data sharing protocols to get a better profile of these individuals and having a better offer which are more tailored to their individual needs. Our principal response was to get people safe and off the street and then do as much as we can to keep them with an environment where they feel stable, safe and be able to recover or get the support they need to have a better life. And that was a key focus of the group.
St George's Hub is the only service in Wolverhampton for marginalised men. We do a profile of everyone that comes here that identifies the needs that they have, and then we have a programme designed around those needs. We work with P3, we work with the Good Shepherd Ministry, we work with a range of churches. The local authority is very supportive. Alternative giving, obviously, we're one of the recipient charities for it. The pound has much more value if you give it to alternative giving than it would be if you gave it to someone.
My name's Lucy Armstrong. I'm from Wolverhampton Bid, which is the business improvement district for the city centre. Alternative Giving was set up through all partner agencies to include the City Council, Westminster Police, P3 Navigator, Recovery Near You, which is our drug services, and Wolverhampton Homes. We know where some of our hotspots are and who's around the city centre, who might be in need of some extra support or engagement. But I think increasingly over the last 12 to 18 months, the visibility of some of our more entrenched rough sleepers who again have been hanging around banks and certain locations where they're then intimidating to members of the public and they're quite openly asking for money when there's no need, when they've got a saturation of services already here, is that that definitely has decreased.
It's a privilege as an organisation to be able to work with rough sleepers. It's an honour for us to be able to actively be engaged as part of the city to try and reduce this problem, utilising our skills and experiences the way that we do. We work in partnership with other agencies, respecting the remits in which they work with. But as a staff team, when we go out, we've also got our pasts, our experiences, and we're able to engage with individuals on a different level because of the journeys that we've all travelled. Especially with our staff team, as you know, we speak over 40 languages, which leads us really well into building trust with clients and reducing those barriers, because we're able to demonstrate that actually we may have come through the same journey.
No individual who is homeless is anything other than a unique person. They have their own problems and their own challenges. There is no one-size-fits-all solution. There is no magic wand. We have to work with people in the circumstances they find themselves in and tackle the problems that they face. The work that we've done through our task group has, I believe, been at the cutting edge of attacks on the homelessness problem. But nevertheless, there is no room for complacency. There is much more that we need to do to challenge not just the needs of homeless people, but to also tackle the fundamental social problems which lead to people being homeless, whether that's through the fact that they have no recourse to public funds, or through issues around mental health problems, or issues around family breakup. It's absolutely crucial that we recognise that there is so much more that we need to do and ensure that we are committed, as a result of our work, to making sure that we tackle the problem of homelessness and reduce the numbers of people having to sleep rough in our communities.